$808 million from three major opioid distributors, nearly $25 million from a consulting firm. The money from those accused of fueling the opioid epidemic in Ohio, it is pouring in, meant to put an end to this crisis. Still, the number of overdose deaths is skyrocketing. For more than a decade, unintentional drug poisonings, which include overdoses, have been the leading cause of injury death in Ohio. 2017 saw the most deadly overdoses ever in the state, but that record may have been shattered during the pandemic. According to the CDC, more than 5,200 Ohioans died from drug overdoses last year. That is a 22% jump from 2019. We wanted to know, how is all of that money going to save lives? So News 5 investigator Jonathan Walsh sat down for a one-on-one exclusive interview with the woman known as Ohio's Drug Czar to see what the state's doing about finding a fix.
Oh my God.
It's never been worse.
You're going to the hospital.
We are in the middle of record-breaking overdoses across Ohio. Attorney General Dave Yost even said Ohioans are dying at a devastating rate.
What's your initial reaction when you see those numbers?
It's just devastating.
Alicia Nelson is the director of Recovery Ohio. When I asked the governor's office who the state's drug czar is, it pointed to Alicia.
It just gives us the drive we need to keep going and keep pushing and keeping our foot on the gas.
Part of that fuel, recent settlement money from drug manufacturers and pharmacies, partially responsible for the opioid epidemic. Billions of dollars across the country and big money for Ohio. Alicia says that will bring new resources for several initiatives, including drug prevention with children.
Make sure that we identify when we may be struggling with or a mental health concern.
More hands-on involvement with those using drugs.
We need to continue to expand the availability of treatment and make sure that we have the workforce, and that's going to be an important component.
And enhancing help for people to maintain their journey in recovery.
And that's peer support efforts, talking with the faith community, that's, making sure that people can get back in school, back to work.
But one of the biggest obstacles the state faces is the explosion of fentanyl use.
We know that 76% or more of our deaths are because of fentanyl.
To fight that, the state has helped put 60,000 naloxone kits into Ohio communities.
It gives us, the folks who really want to see that person succeed and get to treatment and get to recovery, a chance at recovery.
But what about the illegal drug dealers and suppliers?
Are we getting the bad guys?
Since we've been at the governor's office, we opened the Ohio Narcotics Intelligence Center.
She tells us that center is supporting local drug task forces, helping gather evidence.
To make sure that they can use cell phones and collect data and really understand what's happening in a case.
But Alicia says we can't arrest our way out of our drug problems.
What are we not doing right?
Folks are going to experience more anxiety, more depression, and need more support.
As these drugs continue to hit our streets, she tells us there needs to be a shift in attitude, away from shaming those who are using drugs and gravitating towards evidence-based practices like medication-assisted treatment. Plus, we also need a better understanding of the mental aspects of drug addiction.
The more we all can embrace that this is just like any other disease, heart disease, diabetes, and that our brains are an important part of our body.
Despite our current overdose rates,
Get you some help.
Alicia says there are reasons for optimism.
I don't want them to lose hope in this fight, that I believe we will and we can overcome what we're seeing.
I'm News 5 investigator
There we go.
Jonathan Walsh.
Well, Alicia spoke about changing our attitudes toward addiction to fight this opioid crisis, and that is exactly the goal of a campaign Governor Mike DeWine launched today. The Beat the Stigma campaign encourages Ohioans to challenge what they think about addiction and mental illness. Also, know their own risks and take care of their own mental health. Alicia says that anybody struggling with drug use can call the state's care line, It's right there on your screen, 800-720-9616.